Types of phlebotomy needles. Multiple sample needles. For most blood collections, a multi-sample needle is used, which is a double-ended needle. One tip of the needle pierces the patient's skin, while the other end is inserted into the evacuated tube. Multiple sample needles have a retraceable rubber sleeve that covers the second tip when it is not inserted in the tube. A multi-sample needle remains in the patient's vein while the phlebotomist is able to exchange one tube for another. The rubber sleeve keeps the blood from leaking onto or into the tube holder while changing tubes. The next type of needle is safety syringe needles. Patients with small or fragile veins benefit most from the use of a syringe because the vacuum of the collection tube is likely to cause the vein to collapse. With a syringe, suction can be applied slowly and gradually so as to vacuum fragile veins as gently as possible. Safety syringe needles come in a variety of sizes, but the most common needle used is a 22 gauge that is an inch long. The next type of needle is a winged infusion set. AKA butterfly needles. This is used for venipuncture on small and or fragile veins, such as in the hands, in pediatric or an elderly patients, and for patients with circulatory conditions or problems, PVD, Reynolds disease, etc. Now the phlebotomist knows, remember to check for patients with condition that make blood draw uncomfortable or risky. Example, PVD, the Reynolds disease, blood thinner therapy, and hemophilia. A physician order will specify potentially life-threatening situation. The butterfly allows greater flexibility in placing and manipulating where the phlebotomist wants to draw the patient's blood. The most common needle size is a 23 gauge. That's for the butterfly. It's 1/2 inch to 3/4 of an inch long. The needle is held by a plastic butterfly-shaped grip. It is connected to a flexible latex tubing and with the proper adapter can be connected to an evacuated tube. Most butterfly needles are now designed to be used with evacuation tubes. Butterflies can help make it easier to draw blood from patients whose veins roll. Example, move around after the needle has been inserted. And the next thing here is going to be needle adapters.